handful of publications. And the topics range from midwifery, pregnancy, maternal child health, patient experience, HIV and AIDS, and sexual assault, to nursing scope of practice, task shifting, patient education, and so on. And you can see that the majority come from these top 3 topics here. So, after looking at more than 1,000 publications, over 54 countries in a 10-year period, we only found 72 index publications covering 12 topics from 20 countries. And so it's evident that there's not a ton of research that's being produced. This is less than 1 publication per year per country. It's interesting to note that we found more publications on the nursing role, so how do nurses feel, what do they do, those kind of questions, than on all of the clinical research combined. We also found 30 studies on the brain drain, which is a substantial proportion, and that's the exodus of nurses to higher paying countries. So through the scoping review, this affirmed what we originally thought, that we needed to look at the gray literature and see what other publications are out there and what were we missing by only looking in index sources. And this first study was published earlier this year in the International Journal of Nursing Studies. So the second study was a gray literature review, and we decided to narrow our focus down to the 25 countries included in the southern and eastern African regions as defined by the United Nations. And this was in order to make our results more applicable to our collaborators in the region. So we looked through many different gray literature sources, such as university websites, through interviews with our collaborators in the region, unindexed nursing and midwifery journals, referrals from major NGOs or governmental organizations, also international scholarly and nursing and midwifery research organizations, and top-ranking nursing and midwifery schools. And we found altogether 262 research projects with 287 unique authors from 17 southern and eastern African countries covering 12 topics. So in all, we did find that there was substantially more research that was available than what you find in the index sources. And we did a comparison to see what was, if there was a substantial or significant difference between what we found in the gray literature versus what we found in index literature. And, oh, I'm sorry, this is the wrong slide, but this shows the countries where we found the research. You can see that by far most of it came from South Africa. These are, in this study we did limit it to studies in English. So these are the English-speaking countries with an E, and then the S shows the countries that speak English, but it's not an official language. And the point of that was to show that even though we did narrow it by English, many of the countries in the region are English-speaking, so it wasn't necessarily a huge limitation of the study. And as I said, we did a comparison to see what was different from the index literature. And the top 3 are the ones with statistically significant differences. You can see chronic disease and pediatrics were more often found in the gray literature than in the scoping review. And patient satisfaction and experience was more often found in the index literature than it was in the gray literature. And this is currently under review. The second aim of my dissertation was to identify what were the research priorities for the region. And we did this through a Delphi survey. A Delphi survey is an iterative survey process where you, when you want to gain consensus on a topic from a group of experts, so it was perfect for what we were doing. You use multiple rounds and you ask a group to tell you what they think on a certain topic, and then you return the results to them and have them re-rank it so that eventually you get consensus on whatever your question is. One of the benefits of this method is that it's easy and and almost better to use if you're not all together in a room, because then you're not influencing each other's opinions. So we thought it was appropriate for this. And looking at the conceptual framework, this is looking at the transmitter and the message. So what we did was, through the environmental scan, so the first two studies, we looked at who's publishing research. And that gave us kind of an initial list that we could use going forward of who might be an expert on clinical or midwifery nursing research. And then we vetted that with our core collaborators and came up with a list of experts that had this criteria, which were a professional nurse or midwife who had a bachelor's degree or higher, had published clinical nursing research, was affiliated with the School of Nursing or Midwifery, or was identified by one of our core collaborators in the region as being an expert on clinical and nursing and midwifery research. We used an incentive in order to gain better participation rates. So we told the participants that if they completed every round of the Delphi survey, they would be entered into a drawing. And one was for an iPad mini, and the other was to attend a research summit that we had in July in Nairobi. And these were our two winners here. And so we ended up having 2 rounds of the Delphi survey. We invited 71 participants initially, and 46 of them responded from 14 countries. And we actually only found experts from 14 countries. So it was 100% of the countries that were invited participated, and gave us a 73% response rate. And then in the second round, we invited all of these 46 plus 2 additional that were uncovered through the first round. And we had 40 respond from all 14 countries, giving us an 85% response rate. I just wanted to show you a map of the region. So the dark gray represents the eastern countries, and the light gray is the southern countries, and the hatch marks represent the countries that participate. So even though it wasn't every country, you can see that it really covered a large part of the geographical area. And what we did was we first asked an open-ended question: please rank list 1 to 5 clinical research priorities for your area. And we took those results, we collated it, we returned it to them, and then we used these levels to indicate consensus. So if more than 70% of the participants identified a topic as being a critical research priority, then we included it as a critical priority and said we had consensus. And then for important, if more than 80% said it was either critical or important, then we ranked that as an important priority and decided that that would indicate consensus, and so on, as you see here. So these are the critical priorities. The first was midwifery, maternal health and mortality, women's health, neonatal care, and infant mortality. And for those people that rated it as critical, which was 97% of the participants, we asked them to give us a little more specific rating of what they thought were the specific topics within this broader topic that were critical priorities. And they ranked maternal health and mortality, neonatal care and infant mortality, and obstetrical emergencies and failure to rescue. The second critical priority was infectious disease and infection control. And within that, there was HIV and AIDS and tuberculosis were the top critical priorities. And these are subtopics of HIV and AIDS that were critical priorities: co-treatment with TB. And then these last 3 are highly related: HIV and AIDS and pregnancy. This is prevention of mother-to-child transmission of HIV during pregnancy. And then option B plus is actually a strategy for PMTCT, where you give all women who are pregnant and HIV positive antiretroviral treatment regardless of their CD4 count. And I thought it was interesting to show what were the moderates. So this was among the lowest priorities for them were Ebola, malaria, nutrition, and palliative care. And I think that this also kind of confirms that when you're an outsider looking in, you may assume that Ebola would be a critical priority for the region. But for the people who are on the ground working, they do not see that as critical. Also, gerontology was a low priority, which makes sense given the difference in the lifespan. And I wanted to show a picture. These are the participants who came to our research summit in July in Nairobi. And this study is being published in Nursing Research, and I think it's coming out in the next issue. So the third specific aim was to describe the predictors of clinical nursing and midwifery research topics within the region. And this was done through multivariate regression analysis of all the data that I had collected so far. And again, if you're looking at this conceptual framework, this is the noise. So the first aim of this study was to determine whether the priorities identified by the experts in the region were associated with the number of times a topic appeared in the literature. The second aim was to determine whether the priorities that we identified through the Delphi survey were associated with whether it was published in the gray versus the index literature. And then the third was to do a temporal trend analysis of the clinical nursing research through the 10-year period that we had collected data on. So the sources of data were, as I said, the scoping review of the index sources, the gray literature, the Delphi survey, and then I also did a search to determine which of the topics had major funding. So one thing that I wanted to do is to ensure that the way that we had labeled the topics matched the research that we had. We did a test for inter-rater reliability, where two scientists independently coded what they thought the research was about, and then we ensured that the topics matched. And we had a Cohen's kappa of 0.71, which is adequate. And then another thing that we did was, so some research, for example, might be on pediatric and HIV patients. So in this scenario, that's really two topics that we're looking at, but we didn't want to count it as two different publications. So we weighted it based on how many topics were in each publication. And I also used absolute country counting. So the first author received the credit for the country, and likewise for their international affiliations or affiliation with the World Health Organization, or their level of education and so forth. So once I had a list of predictors, then I did a univariate analysis to determine which of the predictor variables would be entered into the model. And I considered those with a significance of less than p equals 0.1 to enter into my final model. And then I retained those that had a significance of less than 0.05. I also examined the variables for interactions. And one thing that I did for when I was looking at whether the priority ranking determined had any association with the number of times the topic appeared in the literature, I considered a Poisson regression and a negative binomial regression for analysis using the AIC. And I chose the one with the smaller AIC. So I had 319 publications in all that were categorized into 20 different topics. 56 had a first author that were affiliated with the Center for Global Nursing. And when I say that, what I'm talking about is some nursing schools have a specific global center where they're trying to do outreach. So it could be that they're sending their students to other countries, or that they have some kind of networks of collaborations with other countries. So it's not necessarily the same as an international affiliation, because an author could independently have some international affiliations but not be affiliated with the